Understanding high blood pressure and exercise.
High blood pressure increases the risk of heart disease and stroke. Regular physical activity can help control it, but not all exercises are recommended. The key is to focus on activities that are gentle on the heart and joints, avoiding sudden bursts of intense effort. Choosing the right cardio routines can make exercise both safe and effective for managing high blood pressure.
Why low-impact cardio is best.
Low-impact cardio exercises are ideal because they provide cardiovascular benefits without putting too much strain on the body. These activities help lower blood pressure by improving heart efficiency and blood flow, all while reducing the risk of injury. For people with high blood pressure, low-impact options are the safest way to maintain a consistent fitness routine.
Walking, a safe starting point.
Brisk walking is one of the safest and most accessible forms of cardio. Walking at a moderate pace for at least 30 minutes most days can help lower blood pressure. You can adjust your pace and duration to suit your fitness level, and it's easy to fit into your daily routine, whether outdoors or on a treadmill.
Cycling and swimming gentle on the body.
Cycling on a stationary bike and swimming are excellent low-impact exercises. They provide a great cardiovascular workout while supporting your joints and limiting physical stress. Both can be easily adjusted for intensity, making them well-suited for people looking to safely manage their blood pressure.
Tips for exercising safely with high blood pressure.
Always consult your healthcare provider before starting a new exercise program. Begin with short sessions and gradually increase intensity as your body adapts. Stay hydrated, warm up before, and cool down after each workout. Monitor how you feel during exercise, and stop if you experience dizziness or chest pain. Consistency and moderation are key to success.